Our next topic is CABG. Popularly we call that as CABG or a coronary artery bypass grafting. A CABG can take place in three ways where the diseased artery, especially the coronary artery, it can be replaced with a venous graft or an arterial graft or an arterio and venous graft. So the code is going to differ based on the type of graft that is being chosen. Usually, a patient who has suffering from arteriosclerosis or any disease of these coronary arteries, there is placement of these vessels, especially the graft, from the patient's own body, which is an autogenous graft. So this graft that is commonly being taken is a saphenous venous graft. Okay. So whenever they are harvesting a saphenous venous graft, we are not supposed to code it separately. Whereas, if the harvest is from any other venous or an arterial graft other than that of the saphenous graft, we can code that separately. You will have to see the number of vessels that are being treated. Either it is the artery or the vein or the artery and the vein. You will have to just count the number of arteries that are being treated and the number of veins that are being utilized in order to treat the vessel. If there is going to be 4 vessels that are going to be treated, you will have to know what the doctor is placing there. Is he placing the entire vessels via 4 veins, or is he treating 4 of these coronary vessels with 2 arteries and 2 veins, or is he provided treating 4 of these coronary arteries with only arterial graft?